I think for me, more recently, this label of being a COVID dissident has come from my U-turn, if you like, or I would more likely want to describe it as evolution in my understanding of the benefits and harms of the COVID-19 vaccine, specifically the mRNA vaccines, so the Pfizer and Moderna vaccines. And I was actually one of the public advocates very early on in the pandemic when the vaccine rollout started in December of 2020, January 2021. I was one of the first to take 2 doses of the Pfizer vaccine. And a month later, I was actually on Good Morning Britain trying to help tackle, in a compassionate way, vaccine hesitancy, which was particularly prevalent amongst the ethnic minority communities in the UK. And I know that's similar in the US, because I convinced a friend of mine who's a well-known film director called Gurinder Chadha, well-known for movies like Bend It Like Beckham, Blinded by the Light, which is on Bruce Springsteen. She was receiving a lot of what at the time I felt was, in quotes, anti-vax misinformation through blogs, and asked me around whether or not she should take the vaccine. And I said to her, listen, vaccines, and I still believe this to be the case, in traditional vaccines, certainly one of the most safest pharmacological interventions in the history of medicine. So I didn't in any way, shape or form even conceive of the possibility of any vaccine causing significant harm, let alone the COVID vaccines. But over a period of around a year, Brett, my opinion changed quite significantly because of a number of different events. Probably the first that made me think about it was my father, who was a retired doctor, the honorary vice president of the British Medical Association, very well-known doctor. He suffered a unexplained and unexpected sudden cardiac death in July of 2021. I was actually involved in in the events leading up to his death because he'd called me. He was suffering from chest pain, which sounded cardiac. I was in London, he was in Manchester, so a couple of hundred miles away. And we were on the phone, and in between our phone calls, he suffered a cardiac arrest, which was witnessed by 2 of his neighbors who were doctors. And despite the fact that they carried out CPR immediately and an ambulance was called, there was a delay in the ambulance, etc. And I was down the line. So it was quite a harrowing experience for me. But and of course, he was also on a personal level. I was very, very close to him. He was my best friend. I knew his lifestyle habits inside out. He was the last surviving member of my immediate family. So it had quite a profound effect on me. But because of the fact that he was otherwise well and I knew his cardiac history, which was non-significant, I asked for a post-mortem to be carried out. And his post-mortem findings were quite shocking. He had 2 critical or severe stenoses or narrowings in 3 out of 3 of the major arteries. 2 of them were severely narrowed. And that would suggest, certainly compared to scans I'd organized a few years earlier, just routine stuff, that he had a rapid acceleration of his blockages. So, my area of interest and research, a lot of my advocacy over the years, Brett, has been on changing the understanding of how heart disease develops, but also what can be done to even potentially halt and even reverse heart disease. That's, I've published on this stuff extensively. You may be aware of that work. So if anybody has expertise in understanding this, it's me. And it didn't make sense. And the only thing I could attribute it at the time, my only explanation, which again didn't fully fit, but I thought, well, you have to think about all the possibilities, was my father under very profound, severe psychological stress that caused an acceleration of his coronary artery disease. And then a few months later, a number of different bits of data emerged, which for me started to put a picture together to suggest that the mRNA vaccines could be a major cause behind my dad's death, and of course, many other unexpected cardiac arrests and heart attacks. And that was, first and foremost, there was an abstract published in Circulation by Stephen Gundry, which suggested that the mRNA vaccines were causing huge coronary inflammation through inflammatory markers that would increase cardiovascular risk very rapidly. At the same time, a colleague from a very prestigious British institution. I won't name that institution to protect his identity, but he basically said that researchers at his institution had accidentally found, by use of coronary imaging, that the vaccinated versus unvaccinated were having huge increases in coronary inflammation as well. But having found this, they decided, and they had a closed meeting, that they were not going to publish these findings because they were worried about the fact that they may lose funding from the pharmaceutical industry. And then only a few weeks earlier, I had been contacted by a journalist for the Times newspaper and actually given an interview where she said that there was reports from hospitals in Scotland of a unexplained rise in heart attacks, about 25% increased risk in heart attacks, which were not associated with COVID, and asked me what was the cause of that. Now, before I'd become familiar with these potential harms from the vaccine, I had again attributed it to maybe the knock-on effect of lockdowns, poor diet, and stress, because actually the major factors normally in the development of heart disease, 80% of heart disease is lifestyle related, are issues such as poor diet, sedentary lifestyle, poor sleep, and chronic psychological stress. So I had predicted there probably would be a signal anyway coming in the next few years, even when the pandemic started, from those factors. And I still think they probably play a role. But then I decided, Brett, after all of this, to first and foremost, my duty as a doctor, and because I have a public profile, I went on GB News, which is a news channel over here, and I said that, I'm concerned there may be a significant link here between the mRNA vaccines and heart attacks, and it needs investigating. That video went viral. I had to put up behind the scenes. Many people don't know this, but after that, I had a couple of very, let's put it this way, medical organizations linked to my medical license and my affiliation, my postgraduate credentials, essentially contact me because of complaints that were made by anonymous doctors that I was promoting, anti-vax information, etc. So I had to deal with that in the meantime over a few weeks, and that luckily didn't end in any specific censorship. But I then decided what I needed to do really to open this up is to spend my time critically appraising the data thoroughly, and then publishing it in a medical journal. And I did this over a period of 9 months. And as you probably know, a few weeks ago, I published these 2 papers in the Journal of Insulin Resistance, where I had concluded unequivocally, based upon the evidence, that the mRNA vaccines need to be suspended pending an inquiry, because the signal of harm is significant and it's based upon very high quality evidence now.
Well,
there's a long answer to your question.
It is a long answer, and there are quite a number of things I want to return to in there. But I think first and foremost, let me just say that's a terrible story about your father, and you have my condolences, and I'm sure my audience is properly shocked by what must have been a terrible realization, not only of his passing, but of the possibility that your profession had been involved in some way in advancing a therapy that had this terrible, terrible consequence. So anyway.
No, thank you, Brett. And on that note, the irony of this is my father obviously had 2 doses of the vaccine early on. He had actually convinced me, because I realized, I knew I was low risk from COVID, and I'm sure we can talk about that a bit later, but he had really convinced me emotionally, because he had lost his wife, my mother, a few years ago, just to get into the human side of it. And I think that he, like many people who are older, had a very, I would say, exaggerated fear of COVID. And for him, obviously, I'm his only surviving son, and he was worried about me, and he said, listen, please, and actually one of the main reasons I had it was because I didn't necessarily need to have it so quickly. I could have waited. It's because of him. And also, as somebody that was the honorary vice president of the BMA, and he also was a prolific writer, he did a lot of media work. He was a very strong advocate, again, for the vaccine as well. So that's also, they're thrown into the picture, which complicates the situation.
Yeah, it sure does. I will say I also received pressure from people who love me and wanted me to get vaccinated. And in fact, at the beginning of the vaccination campaign, I thought I would. I was pretty excited about the vaccines.